the VCA Voice podcast. I'm your host, Dr. Marie Kerl. Our goal with the VCA Voice is to showcase how VCA Animal Hospitals is taking care of the future of veterinary medicine. We'll bring our purpose to life through meaningful conversations about care, our culture, and the communities we serve. On today's episode, I'm happy to welcome Dr. Rich Levine. Dr. Levine is a regional medical director for the Mid-Atlantic region of VCA Animal Hospitals. Welcome, Rich. It's great to see you.
Thank you, Marie. Thanks so much for having me.
Tell me a little bit about your story in veterinary medicine and also your story with VCA.
Well, my story starts a long time ago. It starts with me being a toddler and living at my father's veterinary hospital.
Wow. Okay.
So I'm a second generation veterinarian, and we grew up right next to the hospital for the first 6 years. And my parents both say that I was fascinated right away with everything to do with veterinary medicine, and particularly surgery. And my mom made me a little miniature surgery gown, and I would get up on a couple of cases of canned dog food and watch my dad do surgery. So that's remained a fascination of mine. I love surgery, and I've always really enjoyed that aspect of veterinary medicine. So I worked on and off throughout my youth at the veterinary hospital, and ended up then going to the University of Pennsylvania after undergraduate school. Graduated in 1981 and joined my dad in practice. My dad and I were partnered in practice for about 20 years, and it was time for him to retire. And so I was looking for a partner in practice, and I thought VCA was a really good fit. And so in 2001, I joined VCA as a partner and stayed on practice with them for another 13 years. About 2011, I was starting to think about retirement. And in 2013, when I sold the practice, we moved to Vermont, my wife and I, and I had a very brief retirement. And I was asked to...
I was going to say that's many years ago, and you're still working.
Yeah. That part of the equation did not add up well for my wife. She was surprised that I wanted to still be involved but I didn't feel like I was done. I really felt that I had something left to accomplish in the veterinary world. And that's when I joined the team at VCA as an RMD, and have just loved my role as an RMD.
Tell me a little bit about the role as a regional medical director. And I know that all of us who are doing and have done that role put a little different spin on it. But tell me about why you chose to stay with VCA and continue doing that, and how it's been for you.
Well, I think I found my way gradually into the role with my passions, which were in mentoring young doctors and being more of a consultant to the more experienced doctors, just trying to help them with finding their best course and best life in veterinary medicine. And the role has allowed me to do all those things. And I really enjoy the teaching part. And so mentorship has been a real important aspect of the role that I've had. But I also have really enjoyed coaching and growing our more mature veterinarians and helping them continue to explore all aspects of the career that interest them and help develop those aspects.
How does your background as a practice owner and your length of time in veterinary medicine influence your guidance for veterinarians?
Well, for one thing, I think it's given me a level of credibility when I go into hospitals, because they know that I have walked the walk already, and that when I say this is something that has worked for me, they take that pretty seriously because I come from that world. And so I think my ability to relate to the leadership in the hospitals as well as the rest of the associates has been very easy because of that credibility I think I brought to the role. That on top of having ownership mentality, being in practice where everything stopped with you, and if the practice didn't succeed, it was really on your shoulders. And so I try to instill that same ownership mentality amongst the hospital leadership, where that they really feel like it's their business to help succeed.
In the role of our medical directors in our hospital, we often identify that there's a lot of similarity in that role to being a practice owner, and that it can be a stepping stone if someone is considering owning their own practice to gain experience doing that. How do we train our medical directors to have that kind of a mindset and mentality about their practices?
I think the first thing is for us to strive for excellence, and that means excellence in medicine, excellence in client care, excellence in management. And if we can instill that feeling of pride in really striving for excellence, I think that in turn gives people that ownership mentality. When you walk through a hospital and you see an area that is dirty, or you see an animal that needs some additional support or help, that you don't just keep on walking by, that you deal with that problem right away, because it is important that every single aspect of the hospital has that same level of excellence. So I think that striving for excellence then is the source of giving people that ownership mentality.
You impress me as someone who has really lived that striving for excellence. How have you continued to grow and advance in medicine and surgery and dentistry throughout your career and remain current, given all of the changes that have happened between the time of graduation and now?
And there have been a lot of changes, that's for sure.
And we're going to talk about that in a minute.
Well, I attribute that or give my father a lot of that credit for instilling in me that constant need for staying current, for wanting to continue to grow and improve, and not getting comfortable in the status quo. A certain amount of knowledge that you get in veterinary school and maybe the first few years of practice, and not to be complacent about that's okay. I know what I need to do to run most of my day. But then to have that constant feeling like you could do more, there's other things that could interest you. And veterinary medicine is such a wonderful profession in that we can go in so many different avenues. If we decide we want to pursue cardiology or orthopedics or exotics, that we have the ability to do that. And I don't think any other medical field gives somebody that kind of latitude to be able to go in any direction that they really want to. And I felt that in practice I could do that. And so I had an interest in endoscopy, and so I got an endoscope. I had an interest in laparoscopy, so I learned about laparoscopy and got that equipment. I enjoyed doing exotics, and so that part was very challenging and interesting. And just that idea that you should never get complacent in your current knowledge base, but always seek to learn more and explore new areas. And that's why I think veterinary medicine is such a great profession.
So it sounds like your dad was a pretty progressive practitioner, and you were able to model that.
Yes, he was. And he practiced into his 80s.
Wow.
And still stayed current.
So you don't need to retire yet?
I think that if I left with his same level, I would have another 25 years and he'd still be practicing. But he continued to grow. He decided in his 70s that he wanted to learn about fish medicine and got into backyard koi medicine and did a lot of work with backyard fish ponds and aquariums. And that was a completely new area that until his 70s he had no experience in. And so I think I took that same approach, that try to keep current and try to learn new things.
So, Rich, tell me a few things that you might cite that have really changed most in veterinary medicine in your career, and then also what things have stayed the same.
I think the fact that when I first started, almost everything that we had in the way of medication and equipment was borrowed from human medicine. And coming in the late 70s, early 80s, we had a lot of surplus Army supplies from, from the Korean War and even World War II, where you'd find these drawers full of archaic surgical instruments, and the equipment were these giant vacuum tube oscilloscopes that, we would use for monitoring patients. And we transitioned to veterinary specific equipment and techniques. And we have, a whole different world in the way of medications. The drugs that we have today, like the new monoclonal antibody therapy that we're using for dermatology conditions, and now with the newest drugs for treating osteoarthritis in cats, are revolutionary in that they're designed specifically for the species that we worked on. We're not borrowing those drugs from human medicine. They're designed just for the species that we work on. And So I feel like that technology is really very different from what we had, a lot more veterinary specifics that drugs and technology that we have now. I think one of the things that's not changed is the type of people that gravitate towards our profession. Mm-hmm. I think that the veterinarians, technicians, and support personnel that we have in our hospitals all have that same love for animals and that same drive to help them that they did when I first started. And I know we talk about the different generations, that millennials are one way or the other, and I find that there's more similarities with each group of new doctors that come in than there are differences. I feel like there's more similarities in their drive to do great medicine and to help clients and to help animals, and their dedication to the profession, I don't think is any less than it was when I started.
Yeah, I couldn't agree with that more. And I'm really excited about the young people entering our profession and also the growth of veterinary technology as its own field. And my first experience working with veterinary technicians who were credentialed was amazing. And I'm really happy that they're a valuable part of our teams as well.
And I think that's one thing that VCA really should get a lot of credit for, is that as a company, the effort that VCA has put into elevating the role of veterinary technology in practice and recognizing how vital it is and giving it the status that it deserves is really unparalleled in the veterinary field.
I'm going to dive a little bit into the role of regional medical director. And if you could start off and tell me how the regional medical director is instrumental in supporting quality medicine and delivery of quality care in our hospitals.
Well, I think one of the things that was a change for me was that we went from my focus as a medical director and an owner to one hospital and trying to make that one place the best it could be, to multi-site management, where we're not only caring for individual practices, but we have to look at a group of hospitals as a whole. And at one time or another in my role as medical director, I had, over 100 hospitals to help with the medicine. And you can't do that without looking at the big picture and manage and looking for common denominators in where can we elevate all those hospitals together and what programs can we put in place that might take care of the majority of hospitals and problems that they have to overcome. And one of the gratifying parts of my job is that being able to identify an area that does have this common theme amongst most hospitals and work together to have all the hospitals benefit from improving that area. And so that can look in the form of training, like we helped work with dental training as being an area that needed improvement. We were just started getting into the phase where we were doing digital dental x-rays, and we didn't know at first how to make that work. Was it just picking some animals that needed x-rays and just doing the ones that we thought had the worst disease? And we felt that was not the right way to go. We really should be doing whole mouth films on all of our patients and looking for occult disease. And we found it. We found a lot of it. And we really have elevated the level of animal care by putting dental x-rays in as standard of care in all of our hospitals. That brought in the need for doctors learning how to read dental x-rays, technicians how to take dental x-rays. And then with all the problems that they found from doing dental x-rays, we need to teach them how to be good oral surgeons, because that became much more necessary when we were finding a lot more disease. And so I found that identifying things like that and developing a program was really an important part of the job and very rewarding, because we're moving the needle in multiple hospitals all at the same time. As far as on a more individual basis, I think the role of the medical director is to go into the hospital and help support the operations side. So making sure that our doctors are aware of their financial responsibility. I think the adage that good medicine leads to good financial performance has always been true, still remains true. And if we do a really good job helping clients with their pets staying healthy and treating illness when we need to, that we do a good job with that, we will be very sound financially.
Rich, how has your role as regional medical director changed over time? And it might be geography, or it might be the kinds of things that you do on a day-to-day basis.
Well, it has changed a little bit geographically. Originally, when I got into the role, I was overseeing 8 states. And as VCA grew, I went from about 70 hospitals to over 140 hospitals. Yeah. And that wasn't sustainable. So we divided those regions up, and now I have 2 states and about 85 hospitals. The growth of the company definitely has changed my role, and having to also help develop ways to service all those hospitals well has been a challenge. And I think the role of the area medical director has really helped me in being able to adequately serve that many practices. And area medical director is somebody who has a part-time role as a field team person, but mostly is in their own hospital and one day a week travels and helps with doing the same work that I do on a more specific regional basis, but overall supporting our same medical goals. I'm fortunate to have a great AMD team that's really helped and allowed me to virtually be in many more hospitals than I could be myself. One of the advantages of having AMDs has been that there's been a miniature think tank in my group when I have AMDs where we can brainstorm ideas and work on a problem together and get input from multiple people. So it's just not all top down, me asking them to do things that I think are the right things to do. It's them giving me feedback or new ideas or collaborating on a particular problem and coming up with a solution. And so a number of the initiatives that have come up over the years have been kind of a group effort to develop that idea and run with it. And so it's been really rewarding from that aspect too, to have people working as a great team and to collaborating together to come up with better ways to do things.
Rich, you're really involved in hands-on teaching and are very skilled at that. How do you approach hands-on teaching and training for veterinarians to share that knowledge, both with early career veterinarians, but also mid-career veterinarians to help them to grow and develop new skills?
I think it first starts with my love for teaching. Mm-hmm. I really enjoy the process of seeing somebody going from being concerned or worried about doing a particular technique or skill to feeling confident that they can go off and do that skill on their own now. And so seeing that transition from somebody who doesn't know how to do something to somebody who not only know how to do it, but then can go ahead and enjoy that new skill and improve their quality of life as a veterinarian by having a larger skill set. And so I think that basic love of teaching is the foundation for that. The benefit to them is not only in being able to do more things, but in having a more enriched career. And I think that's what keeps people interested in veterinary medicine, is that they continue to grow throughout their career and learn new things and get new competencies. So my hands-on, it's just that, it's hands-on. When we do a wet lab, I'm there with the doctors that I'm teaching the new technique with, actually doing it alongside of them. And I think that also gives me the credibility that they know that I know what I'm doing because I'm showing them right in front of them how to do it.
Yeah, the skill of teaching actually, I think, helps individuals who teach to grow as well, because there are always questions that you don't know the answer to. And as time goes on, the questions change, but they help to really keep teachers engaged in what they're doing and monitoring success by growth of their students and wanting to watch them succeed and grow and do a wonderful job.
Well, it definitely has kept me on my toes because
Yep.
I don't want to be caught flat-footed and not have the answer to a question. So I'm constantly trying to stay ahead of whoever I'm working with. And I wasn't aware of how much that really would be a part of my job once I was an RMD. You can't rest on your laurels because medicine is constantly changing. And every day I'll get 10, 15 questions about things that are new and I may not have heard of. And I have to quick run to the resources and brush up on a topic that I may not be familiar with to help provide information to somebody who's asking. If anything, the learning curve has steepened since I've been in this role because of the requirements of it. That so many people looking to you for that information has really kept me continuing to kind of stay ahead of that.
Rich, we talk a lot about burnout in veterinary medicine. What role does education and gaining skill do in affecting the burnout quotient that we talk about?
I think it's huge. It certainly has been my savior as far as not feeling like I was ever at a point where veterinary medicine wasn't exciting for me and wasn't new and interesting. And so I think that gaining new skills is really very helpful for having the framework of this is something that continually can be inspiring and never gets stale or old, and there's always a new challenge ahead. So I think that continuing to learn and grow does really help in preventing people from feeling like that they're not in the right profession. There's always something new to explore for me.
You've introduced and been involved in introducing a number of different initiatives in the Northeast, North Atlantic groups, and now Mid-Atlantic. Tell me about some of those innovations that have really hatched in your area with your colleagues that have grown and become amazing programs.
I think the two that I'm most proud of are the new doctor mentorship program that we began in my group and the adverse event reporting system that we started in our areas. The mentorship program is designed to help onboard our new doctors and get them comfortable with seeing clients in a more real world setting than they got in veterinary school. And we found that being able to slowly introduce them to day-to-day practice without throwing them right into the lions to begin with really helped them feel that they were getting the support and the knowledge to get in there and see clients without feeling terrified or overwhelmed by that experience. And we've really felt that it made a difference, and the company as a whole saw that as well. And it is now incorporated into all of our veterinary hospitals, and we call it VCAcademy, which is this mentorship program that helps our new doctors get established in practice.
Before we go on to the adverse event reporting, there's this term that was introduced in the early 2000s, a practice-ready veterinarian. And I think our educational institutions do a wonderful job at preparing their students to enter into the career. But I think that term has led students to think that they should know everything at the time they graduate. And that's, first of all, not possible. And it's never been the case. That next step of getting into whatever area of practice you're going into is the time where you really start to test those skills that you've learned in school and discover more about yourself as a veterinarian, as a practitioner, and where your interests are.
And I think, too, that some veterinary schools have had to trim back curricula to the point where graduates don't have some essential parts of learning that they need. And dentistry is one of those. We have veterinary schools that don't have good veterinary dental training programs. And with this shift in elective surgeries over time going out of the GP practice and specialty practices taking away some of the more sophisticated surgeries, dentistry has become really the bread and butter of the GP practices when it comes to surgical. So oral surgery is probably the most commonly performed type of surgery we have in our hospitals now. And for new graduates to have no training in that area is just not acceptable. So we had to pick that up and train our own students, our own new doctors, on how to do good oral surgery. Even that alone is made the program worthwhile. But there's so many other aspects to that onboarding that I think is so helpful in having them being able to sort of phase gradually from watching to partnering to doing on their own over a 3 to 6 month period of time has really led them to be more comfortable, competent, and happy doctors. So I think it's really been a great program. And there's the other side of that is that our mentors have come forward and shown how they are so happy to help train other doctors. And so they have that same love of teaching that I do. And now they have a way to more formally apply their interest in teaching. So we have a great group of mentors that have stepped up to help with this program.
Tell me a little bit about the adverse event reporting that you mentioned earlier.
So I have to give credit to my counterpart, RMD, for helping put this together. We did have a reporting system already in place on a national level, but the questions that it were asking were not really the same as what we were asking with our reporting system. And for us, it was more about why did the event occur and what can we do to help have it never happen again by putting certain systems in place that don't rely on just human decision making. Sort of like having airbags in your car. Those things are there no matter, we don't have to put a switch on or remember to do something. They're just there to help protect us. And that has led to a company-wide even a Mars-wide initiative to develop a really good adverse event reporting system where we have a good idea of what's going on and why the event occurred and what we can do to help avoid that happening again in the future. And I really do believe that it has led to less adverse events as a result of this, and an increased awareness that these things are occurring in our hospitals. Some of these events we just didn't know were happening because there wasn't a client complaining or an employee letting us know. So these things happen and we just weren't aware of them. Now we have encouraged people to come forward when there's an adverse event and to be in a no-blame environment where they can feel comfortable in letting us know something happened without worrying about any kind of repercussions. And that has led to a much more transparent workplace where when something's happening that needs to be addressed, it is addressed and we're aware of it.
Tell me a little bit about how we attract and develop future leaders of the veterinary industry. How do we take an associate in a practice and make those leadership roles attractive to them and inspire them to want to do those roles?
Actually, I was thinking about this just today, and my thought is that we should be starting very early in their careers. And so introducing some of these concepts into the mentorship program, I think would be really extremely helpful. Right now, our mentorship program is mostly based on attaining certain levels of skills and confidence that our new doctors need, but not a lot on looking at them as future leaders right off the bat. And I think that by incorporating more programs in that onboarding that would be addressing leadership skills and business acumen would be a really good thing to do. And I think the time to do it is right when we're starting to onboard these doctors, not waiting until they've been in practice for a number of years before we start trying to develop them as leaders.
Rich, tell me a little bit, since this is on the occasion of your retirement, what's next? What are you looking forward to? Not having to be an RMD every day.
Well, I do really enjoy photography. I really enjoy outdoor sports and live in Vermont. So skiing is going to be a daily activity that I'll get to enjoy that I haven't as much as I would have liked to since I've been an RMD. Right now, usually I'm heading out of town as the storm is moving in, and so I'm not taking advantage of all the fun that I could have. So I'm looking forward to that. I still plan to stay involved in some of the training programs that I've worked on over the years, and plan to do that in a part-time way going forward. But travel and photography and cycling are also among those things I hope to do a lot of.
What advice do you have for either new veterinarians entering the profession or someone who is mid-career and maybe thinking of a change or what's next?
I think that I go back to earlier what I said about not ever being complacent and happy with the status quo, and looking at what could be down the road that would pique your interest and go for it, and not be afraid to go into new areas where you may not have expertise yet. We have the training and the facilities and the availability to grow skills, and that we shouldn't be afraid to expand our knowledge base and expand our skill set. That I think will really overall help veterinarians have a great, satisfying career.
That's wonderful advice. Rich, thank you so much. It is always a tremendous pleasure to speak with you. And I have your cell phone number, so you're not off the hook for me reaching out to you. And I really, really appreciate you sharing your guidance and wisdom for our listeners as well.
Thank you so much for having me, Marie. It's been really fun.
Thank you so much for listening in. If you enjoyed today's episode, please consider subscribing. Don't forget to leave a review to let us know your thoughts, and share the episode with friends. Follow VCA Animal Hospitals on social media at LinkedIn, Twitter, Facebook, and Instagram. For more inspiring stories, visit our website at VCAvoice.com.